When we breathe, air travels down the throat, through the windpipe and into the lungs. The narrowest part of that pathway is in the back of the throat. When we're awake, muscles keep that opening relatively wide. But when we sleep, those muscles relax. That narrows the opening. The air passing through may cause the throat to vibrate. That causes snoring. Obviously, many people experience this. But in some people, the throat closes so much that enough air doesn't get through to the lungs. When this happens, the brain gets a message to wake up. The brain quickly activates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This only takes a few seconds. You may not even know you've awakened, but this process may happen over and over, hundreds of times, all night long. You may never get into the deep, restful stage of sleep. As a result, you may feel exhausted when you wake up and feel sleepy all day. Many mistakes and serious accidents are caused by sleep deprivation.
Dr. Rukhsana Najib, who has vast experience of anesthetizing patients who have to undergo first DICE and then surgery. She started it some 2 decades back at GMC Srinagar, and she will be joining us in theatre as well. So,
respected Professor Latif sir, esteemed faculty members, respected professors, other faculty members and my students. It's a great honor to be here to inaugurate a very important procedure which we are doing. It will be live. It is about DICE, that is drug-induced sleep endoscopy. Very glad to share that we started it 4 years back. We had a joint paper on it. So Professor HOD, Dr. Roof, he told me that we want to start this case as a thesis for our student. But from the anesthesia point of view, it's very difficult. So how do we go ahead? I said that I will give this topic to my student also, so this will be a joint venture on both the parts. And what is the importance of this DICE is that before going for triple urinoplasty, they would operate upon all the 3-4 places once the patient had slowing or some obstruction and there was sleep apnea. So the importance of this DICE is that because of drug-induced sleep, you will see what is the cause of obstruction, why does he have apnea and why does he snore. So that particular area is operated and that is a big relief to the patient because that part will be operated because that will be 1/4 of the surgery that we were previously doing. And these patients are very difficult because they are usually obese, and as they are obese, their body mass index is very high. So there is an anesthetic challenge for such patients. So we have to be prepared for any issues which can be because of high body mass index, because of the difficult intubations, because of difficult airways. Third live workshop, but the importance of this workshop is that the type of surgery is totally different, which is very latest in GMC Srinagar, and hats off to our ENT team who have started it in just 4 years.
Having a secondary bleed and return to theatre, there can be a little bit of few drops of blood, but return.
By doing DICE, that if the tongue base is not large, epiglottis is not collapsing, then the intubation is going to be easy.
what are your comments regarding dynamic MRI visual DICE?
Yeah, dynamic MRI is also a very good thing. The only
operating, there is no bleeding. Where I am holding just with my tooth forceps, it is actually bleeding.
You can see this tonsillar lift. Now, while pulling the tonsil medially, you can see the end of the tonsil. Now, this is the anterior pillar, this is the lymphoid tissue of the tonsil. Can you just show the audio in the external camera, please?
Is it 7-4?
7 and 3, sir.
7-3. Okay.
Standard 7 and
7 for coagulation and 3 for coagulation.
can see these small vessels.